Each year in the United States, more than 270,000 women are diagnosed with breast cancer. Although the incidence of breast cancer has been on the rise since the 1980s, the majority of breast cancers are discovered at an early stage. Numerous studies have shown that long-term survival rates in early-stage breast cancer patients treated with lumpectomy followed by radiation therapy are equivalent to survival rates following mastectomy.
Patients with early-stage breast cancer can receive either mastectomy or lumpectomy followed by radiation therapy. Traditionally, radiation therapy is delivered in a series of treatments Monday through Friday for a period of 6 weeks. Partial breast irradiation is the treatment of the breast tissue directly around the lumpectomy site. And the rationale for partial breast irradiation really comes from the research studies which show us that after lumpectomy, if a tumor were to recur, it's most likely to recur in the part of the breast tissue that is directly around the lumpectomy site. So we have discovered that if radiation therapy is delivered to this area, then the risk of recurrence can be reduced with a partial breast treatment. Mammosite and other partial breast irradiation techniques treat only the tissue that's at highest risk for recurrence. That means we can spare or exclude the normal breast tissue away from the lumpectomy site from the effects of radiation therapy.
Treatment with mammosite is completed in several steps. Here's how it works. Following the decision to proceed with breast conservation therapy, the patient has a surgical procedure called a lumpectomy to remove the cancerous tumor. Radiation therapy is needed to minimize the risk of cancer recurrence. After the lumpectomy, the surgeon places the mammosite balloon into the center of the surgical cavity. The balloon is then inflated to optimally position the breast tissue to receive the radiation dose. During the radiation treatment, the mammosite catheter is attached to a machine that houses the radiation source. A thin wire with a tiny radioactive seed on the end moves up the catheter under precise computer control into the center of the balloon. The seed irradiates the tumor site and the area immediately surrounding the cavity where tumors are most likely to recur. After the patient receives the prescribed dose of radiation over a 5 to 10 minute period, the seed is removed from the balloon, and after 5 days of treatment, the balloon is deflated and easily removed from the breast. A lumpectomy followed by radiation therapy with mammosite allows you to preserve your breast and treat the tissue that is at highest risk for recurrence by placing the radiation within your breast. In addition, mammosite is an accelerated radiation treatment that is generally delivered over a period of 5 days on an outpatient basis, so no hospital stay is required.
The main benefit to the patient for using mammosite is that the time required to deliver radiation therapy can be reduced from 6 weeks to about 5 days. This is beneficial for women who have active lifestyles, or perhaps women who live a fair distance away from a radiation therapy facility. One thing that we've learned is that many women are not being offered breast conservation therapy for the treatment of early-stage breast cancer, and sometimes the main factor in this decision is that it's inconvenient to have the radiation therapy. So we feel that mammosite will help to increase the number of women who can have breast conservation therapy as treatment for their breast cancer.
Treatment with the mammosite involves 4 steps. Step 1. Tumor removal, creating a lumpectomy cavity. Step 2. Mammosite placement and balloon inflation. Step 3. Development of a treatment plan. Step 4. Delivery of radiation and mammosite removal. Once your diagnosis of early-stage breast cancer has been confirmed and it has been determined that a lumpectomy followed by mammosite is appropriate, you will be scheduled for your lumpectomy surgery. During the surgical procedure, the breast cancer tumor is removed, creating a lumpectomy cavity. The mammosite balloon may be placed into your breast, either at the time of surgery or in a separate procedure following your surgery. During mammosite placement, the deflated balloon is advanced into the lumpectomy cavity and is then inflated with a saline solution to fit snugly into the cavity. A small portion of the catheter will remain outside of your breast.
A patient that chooses to have the mammosite catheter placed, either at the time of surgery or after surgery, can expect very little pain. Most patients say that they have a sense of fullness, that the catheter may feel a little heavy, but rarely do patients complain that it's painful. The catheter is soft and flexible.
After the mammosite is placed, you will visit a radiation oncologist to have your treatment planned. During your initial visit, an image called a CAT scan will be taken. This allows the doctor to see exactly what the balloon looks like inside of your breast. From this image, the radiation oncologist will complete your treatment plan and determine the amount of radiation that you will need. Once your treatment planning is completed, you will be ready to begin receiving your treatments. Typically, treatments are given for 5 days. 2 treatments are given on each of those 5 days, separated by 6 hours. During the radiation treatment, the mammosite catheter is attached to a machine that houses the radiation source. A thin wire with a tiny radioactive seed on the end moves up the catheter under precise computer control into the center of the balloon. The seed irradiates the tumor site and the area immediately surrounding the cavity where tumors are most likely to recur. After the patient receives the prescribed dose of radiation over a 5 to 10 minute period, the seed is removed from the balloon, and after 5 days of treatment, the balloon is deflated and easily removed from the breast.
Patients don't feel any discomfort from the actual radiation therapy treatments. They may be somewhat uncomfortable from the mammosite applicator being in place. Generally, the discomfort is mild. I've noticed that most of my patients require only a mild pain medication, if anything, for the discomfort of the catheter itself. The radiation treatments do not cause pain.
The breast-related side effects associated with mammosite treatment are similar to those experienced with other breast procedures and are generally minor and diminish with time.
Some of the common side effects that people have noticed are it's possible that the patient may notice some redness and swelling on the skin after the radiation treatment has been delivered. This can sometimes appear within days after the mammosite treatment is completed, but it is normal for the procedure and it's a temporary side effect that will fade with time.
Both physicians and patients alike are finding that the mammosite provides an effective means of delivering local radiation with generally minimal skin changes to the breast. In the initial mammosite clinical study, cosmetic outcome has been rated good to excellent in 88% of these patients. Patient satisfaction in this group has been overwhelmingly positive.
We've been very satisfied with the results of the mammosite treatment. Primarily from a cosmetic standpoint, we've noticed that the results are excellent. So far, we've been following our patients in terms of tumor control, and we find that the results there are excellent as well.
We've been very happy with the cosmetic results from the mammosite catheter. There's very little skin reaction compared to external beam, very little skin thickening, and I think the patients have been generally very pleased with the outcome of their breast following the partial breast irradiation.
What I liked about this one with the mammosite was that you could treat breast cancer, and I think a rather highly sophisticated way, with not that much interference with my daily life. And that really appealed to me. A mastectomy was out of the question, really. I really liked the idea of only going, 5 days a week for radiation. I liked the idea that I could have a lumpectomy and not have any severe damage done to the breast. The primary benefits of the mammosite to me, and these are the reasons that I would recommend it to anybody who's a good candidate for it, are the time involved, which takes really about basically 2 weeks out of your life. That's it. It is also site-specific, so the radiation is being directed at an area where tumors are more likely to recur.
With growing awareness on the issue of breast cancer and the treatment options now available to women, mammosite has been the subject of much media attention. Since its availability in 2002, the mammosite has been used to treat thousands of women and is offered in more than 400 centers nationwide. Here we share with you some of the featured stories on mammosite and the patients who have undergone this therapy.
Well, I think it's wonderful, that you can have it over in 5 days instead of 6 weeks and feel good, and not have the effects of the radiation.
I think that this has to be appreciated as an evolution in our treatment. Just as the surgeons went from mastectomy to lumpectomy, now as radiation oncologists we're going from whole breast radiation to partial breast radiation.
It's cost effective, it's convenient, it's safe, and it's done in a week instead of 7 weeks with exactly the same results.
I think it lets you get on with your life a lot faster.
You preserve the breast, and instead of having, let's say, 37 external treatments to the breast, you have treatments over 5 days. Actually, we get 10 treatments, one twice a day, but it's over a period of 5 days instead of 7 weeks.
You go twice a day for 5 days and you are done. You are to the point that it would take doing external radiation once a day for 6 weeks.
Had the mammosite not been available, I probably would have gone for a mastectomy to avoid the radiation treatment.
If you have questions about mammosite or the treatment's appropriateness for your specific condition, please ask your doctor.